Far from the vaccine headlines, not far from Quebec City, the construction of Canada's long game. If all goes according to plan, this is where a homemade vaccine for COVID-19 will be made, from start to finish.
I think it's a part of the role of the Canadian public health to be able to develop strategies to protect Canadians.
Medicago, a biopharmaceutical company specializing in plant-based technology, is leading the race for a Canadian-made vaccine. And even though approved vaccines are already going into people's arms, the urgency here to keep moving forward, faster, hasn't let up. Because this is about immunity on a whole other level. Nathalie Charlon is the Senior Director of Scientific and Medical Affairs at Medicago.
So to secure the production of vaccine within our own borders, I think is important. So we've been working on this technology to address emerging threats for many, many years. So we are ready to go.
Ready to go now and in the future. When the first batches of vaccine landed in Canada, Ottawa had already earmarked more than $1 billion to keep getting more. But it has also been investing hundreds of millions of dollars in vaccine research and manufacturing here, investing too in the promise of vaccine independence.
With this COVID-19 crisis, Canada has come to the understanding that it needs to be a player.
Scott Halperin is the director of the Canadian Centre for Vaccinology in Halifax. Canada's strategy, he says, is about doing what it can to protect people now while going back to the future.
We used to have capacity. We lost capacity. Canada was at the lead of vaccine manufacturing back in the 50s and 60s with the Hanomansing laboratories, and there were production facilities in Quebec as well. We lost that as globalization occurred and companies moved their facilities to cheaper places to make vaccines. We didn't step in and say we need to do something to maintain facilities here. And I think we're learning that was probably not a good idea and need to reverse that trend.
Toronto's Connaught Medical Research Laboratories shared headline news across Canada this week.
That historical trend has already had an impact. Back then, the Connaught laboratories at the University of Toronto played a key role in developing and improving immunizations for rabies, smallpox, and polio.
And the vaccinated blood, thus trained to deal with the real poliovirus, makes the person immune.
When the labs were sold, Canada's public manufacturing capacity was gutted. And when the pandemic broke, promising research here was stalled.
Within 5 weeks, we had our vaccine made in the lab and ready to go into animal testing. We were right on track there. And
last spring, the Vaccine and Infectious Disease Organization was a front-runner. Now it's catching up. The Public Health Lab at the University of Saskatchewan was the first in Canada to successfully isolate the COVID-19 virus. And its vaccine candidate was one of the first in the world to prove 90% efficacy in animal studies. But delays in obtaining vaccine-grade components from suppliers to keep the research going slowed the momentum.
The research here that we're doing is really cutting edge and at the forefront of vaccine research in general.
Dr. Volker Gertz leads the team at Vito.
I think where we're lacking behind is then taking that research and getting it into product. I think that's the recognized lack that we have at the moment, and that's why we're seeing investments right now in building our capacity to do that.
Tens of millions of dollars of government funding is going towards Vito's vaccine development and manufacturing. Its facility is being upgraded to produce human-grade vaccines. It should be ready by the end of this year, and once it's up and running, will manufacture up to 40 million doses of vaccine a year.
It is important for Canadians to have long-term access to vaccines that are made here, made for Canadians. And we might find ourselves in the future again in a position where we're lacking behind and maybe then we're more unlucky and not getting access to these vaccines. So I think in the long term, it's very important for Canada to have sufficient vaccine development and manufacturing capacity in the country so that we don't rely and depend on other countries in the future.
But the immediate future is also uncertain. There's not enough vaccine for everyone yet. The spiraling toll on lives, the burden on exhausted healthcare systems continues. So does the crushing economic and mental fatigue. And while more vaccine is expected, there could be production glitches, delays in delivery. All that demands a Canadian backup.
I think to be self-sufficient is important, especially in these times where the whole population is at risk.
And self-sufficiency isn't far away. Medicago's clinical trials are moving along, and if they go well, a made-in-Canada vaccine will be available by the end of this year. When the facility in Quebec is ready in 2023, that means all of Medicago's vaccines will be produced here too.
Even with coronavirus, we don't know if it's going to go away after this pandemic. It might become what we call endemic, a bit like influenza, might come back every year. So we might need to develop vaccines for new strains circulating.
That will help Canada defeat COVID-19 and prepare for other emerging viruses. Viruses that may not become global pandemics, but can cause deadly disease.
So we want to be able to have multiple irons in the fire.
Halperin says Canada needs to be able to protect its own population and also has a moral responsibility to the developing world.
It's important, considering that we need billions of doses worldwide, even if we don't need it for our own purposes, having that capacity to help supply the world's needs should be an important priority for Canada as well.
It's why he says Canada must continue investing, must commit to the long haul.
What's at stake if they don't?
We're back to where we were for the next time it comes around, a mad rush, and having to depend on the early ones from biotech companies that were nurtured elsewhere.
Security, independence, that is the end game. And the pandemic has already proven time is on no one's side.
So, Joanna, you mentioned thinking ahead beyond this pandemic. What's the specific warning there?
Well, every expert we spoke to, Andrew, said the big takeaway from this pandemic is that Canada needs to become self-reliant in vaccine supply and ready to respond quickly to the next viral threat. And it is a matter of when, not if. On average, a new emerging virus shows up every couple of years. More often, if you consider the diseases that infect livestock first, then get passed on to human. And while they don't all, fortunately, become global pandemics of this scale, they do cause severe disease. And think about SARS, H1N1, MERS, Zika. Those all happened in the last few years and underscore why Canada needs to be so self-reliant when it comes to vaccines.
And the World Health Organization has said all along that poor countries will need help to vaccinate. What's the case for Canada to be part of that?
Well, if Canada wants to be a world player on the stage, it does have to contribute to the global vaccine supply, and there's a need for it. And it all hinges on us returning to some kind of normal. It hinges on the world returning to normal, and that's going to require mass vaccinations and will require billions upon billions of doses.
Joanna Remiliotis, thank you very much.